This is Module 6, our last module in promoting successful rehabilitation outcomes in multiple sclerosis. The focus of this module is on exercise for health and wellness in MS. Evidence supporting the use of aerobic exercise in multiple sclerosis was identified back in 1996, the first study examining the benefits of exercise for individuals who were ambulatory and participated in 30 minutes of exercise on an Airdyne stationary bicycle for 3 times a week for a total of 15 weeks. For those individuals that participated in this exercise program, it was reported they experienced an increase in upper and lower extremity strength. There was an improvement in their VO2 max, their oxygen consumption. All subjects reported a decrease in fatigue. As well, they reported reduced depression and anger at weeks 5 and 10, and improved social interaction, emotional behavior, home management, and recreation. So literally, 1996 was the beginning of the research examining exercise in multiple sclerosis. Individuals interested in participating in a wellness program should first undergo an evaluation by a rehabilitation professional who is knowledgeable of multiple sclerosis. The evaluation program should consist of a cardiopulmonary assessment, typically performed on a stationary bike for 5 minutes, measuring resting heart rate, blood pressure, respiratory rate, and then intermittently measuring through the 5 minutes, and then of course at the end of the 5 minutes of exercise. In addition, a fall risk assessment and the individual's ability to utilize the equipment safely should be part of the evaluation process. And then probably most important, finding out what are the patient's goals for exercise and what type of exercise do they like to engage in. Not everyone likes to do a stationary bike or weightlifting. If we prescribe a program for the patient that they're not really interested in, they're likely to be adhering to the program is obviously not as good. If we find out that the patient is interested in yoga or Tai Chi or a swimming program, then we should focus our exercise prescription to that area of interest and design the program to meet the patient's goals. Let's look at a variety of exercises that patients might participate in during a wellness program. This is Mike. His EDSS is 8.0. He uses the wheelchair for all of his mobility. He is unfortunately not able to ambulate. And yet you see him transferring from the chair onto an elliptical. Challenge there a bit in the beginning, getting his stability. But once securely on the elliptical, Mike goes for 20 to 25 minutes exercising aerobically. He does not use the upper extremity component of it in the beginning, but once he's warmed up and stabilized, he gets all 4 extremities moving. Great ankle range of motion, great for the circulation in the lower extremities. You can see it brings much pleasure and enjoyment to him. This is the type of exercise Mike likes to do. Here's Deal. We saw Deal earlier in the modules. Higher functioning patient. She loves to golf. So we've got to figure out how can we help her play 9 and sometimes 18 holes of golf. When should she be walking? When should she be using the cart to get from hole to hole? Letting her practice her golf swing in the clinic is also part of therapy. Look at the nice weight shifting and balance we can promote for Deal. And again, you see a smile on her face. Here's Andy. We've seen Andy a couple different times in the modules. Andy has weakness on that left leg and left arm as well as spasticity, and yet he's able to do the leg press. He feels that doing the leg press not only increases the strength in the left leg, but also promotes stretching of those spastic muscles. The 2 ladies here are using the treadmill for their mode of exercise and able to talk and engage socially while they're exercising. We're back to Andy again on the interactive gaming device, in this case the Wii Fit. And I have to add, as you're watching Andy weight shift and balance, after an 8-week pilot study with us, he was able to return to showering for his hygiene versus using a bath. So a lot of benefits here.
I was first affected in 1986. I was experiencing severe leg weakness and fatigue. I was really tired all the time, and I had leg weakness, leg numbness, and at times blurred vision or double vision, and I was just really tired. I went to the doctor, and they sent me to a neurologist who then tried to find out what it actually was, but ended up treating me with symptoms consistent with multiple sclerosis. I do exercise approximately an hour and a half a day at home, stationary bike, stretching, and then exercise on the Wii Fitness. Any effects that I've had with multiple sclerosis were explainable because they were due to another type of illness. Anytime you have a different illness, it does affect your MS symptoms. Overall, I know that I would not be able to do what I'm doing if it weren't for exercising. It's something that you have to do, and it's improved my overall health condition.
I was diagnosed in 1991, 20 years ago. I was 39. My first symptoms were the balance started going, and then the double vision in my right eye, which I still have. But I do eye exercises and exercise at the Wellness Center. I still have weakness in my right side, but the brace that I wear has helped me tremendously, and I'm getting stronger doing exercises at the Wellness Center. I do mostly things for my legs to get them stronger. I climb stairs because I'm terrible at that. I think I've improved. Before that, I never exercised. No. If you don't use it, you'll lose it. So exercise is great.
Therapists involved in designing an at-home exercise plan should take these factors into consideration. Number 1, fatigue. We've talked about that through these 6 modules. Utilizing cooling devices, whether it's an oscillating fan, a room air conditioner, hydrating frequently during exercise, all of that should be prescribed to the patient in addition to the exercise program. Educating the patient about day-to-day symptom variability and modification of their exercise program based on those symptoms is very important in MS. Requesting that the individual participate in documenting in a diary or logbook their performance of the exercise and bringing that back to you for reevaluation after a 4-week period. The exercise program that they're performing at home should obviously be modified based on their ability to achieve the goals established with the exercise program or modify to make the goals more readily accessible. One other factor to consider is certainly the on-site exercise program that we saw in the previous video encourages social support as well as socialization, a lot of engagement and dialogue for individuals who share some of the common challenges of living with multiple sclerosis. The reassessment for the fitness plan, in addition to reviewing the diary or logbook, should include cardiopulmonary fitness on the bike, so again performing heart rate and blood pressure monitoring in addition to respiratory rate, being cognizant of the respiratory muscle weakness. Ask the patient to complete a patient satisfaction survey, as well as quality of life evaluation tools. The most common is the SF or short form 36, and another form that can be utilized is the HSQ-12 or Health Status Questionnaire 12. The patient satisfaction survey as well as the quality of life forms can help you in modifying the patient's program. This concludes the 6 modules designed to educate you about rehabilitation in multiple sclerosis. We want to take the time to extend a big thank you to Accorda Therapeutics for providing the educational grant to the Consortium of Multiple Sclerosis Centers for this video on rehabilitation in MS. And of course, a very big thank you to all the people living with MS who participated in demonstrating some of the challenges they face as well as the value of rehabilitation.